Good evening, everyone, and welcome to today's presentation, Telecleft Vector Lectures on Comprehensive Care, organized by the Smile Train in collaboration with the West African College of Surgeons. I'm Emilia Sandra Ashiagbo, and I will be your moderator for the session. We are very excited here to have Barbara Amposa Frimpong with us today, who will be sharing her expertise on parent training and home-based intervention strategies. Who is Barbara? Barbara Amposa Frimpong is a principal nursing officer and a nurse coordinator at the National Cleft Care Center in Komfo-Anokye Teaching Hospital. She holds both a diploma and a degree in nursing with a certificate in speech for children born with cleft, that is, cleft speech provider. Barbara has been actively involved with the Ghana Cleft Foundation for over 15 years, where she has contributed significantly to patient care, coordination, and advocacy. She is married and blessed with 3 children. Barbara, over to you. Audience are listening. Thank you.
Thank you. My name is Barbara Amposa Frimpong, and I'll be presenting on parent training and home-based intervention strategies, empowering parents to enhance speech development in patients with cleft. So this is going to be our outline. We'll first have a look at our introduction, cleft and its impact on speech, the importance of parents' involvement in speech therapy, the home as a therapy hub, home-based interventions for various milestones, then the role of technology, that's telecleft, parent-implemented interventions, the future of cleft speech therapy, and then we conclude. So for our introduction, the critical role of parents and home-based interventions in managing speech for children with cleft. Cleft-related speech difficulties can significantly impact a child's communication and confidence. Traditional clinic-based therapy is often not frequent enough to produce lasting change. Hence, home-based interventions offer a powerful and scalable solution to bridge this gap. What impact does cleft have on speech? Like we all know, cleft lip and cleft palate are openings or splits in the upper lip, the roof of the mouth, that's the palate, or both. It can be unilateral incomplete or unilateral complete. It can also be bilateral complete or bilateral incomplete. A cleft can prevent the separation of the nasal and oral cavities, leading to airflow issues during speech. Not only can it affect speech, it can also affect feeding. When there is a split in the palate, as the baby or the child feeds, there is regurgitation of fluids and liquids into the nose, which can lead to aspiration. This often results in hypernasality. They have nasal speech, and there is also nasal air emission. This is where there's escape of air when high pressure sounds are being made, making speech very difficult to understand. Children may also develop compensatory articulation errors, such as glottal stops, which are produced incorrectly in the throat. What is the traditional speech model that we've been using? The speech and language pathologist or therapist, depending on where you are coming from, is a trained expert who diagnoses or who evaluates and diagnoses specific speech disorders and creates a therapy plan. They do not just do with speech, they also deal with swallowing disorders. Sessions are typically structured and goal-oriented, often conducted in a clinic setting. That's a traditional way of doing therapy. The limitation is a lack of continuous daily practice, which is very vital for motor skill development. The foundational principles of parent teaching. Why are we training our parents to be part of speech therapy or to provide speech therapy in their homes? Parent training is about teaching caregivers how to facilitate speech development, not just what to do. And their approach is very or often naturalistic because it's their own setting, it's in their own environment where they are very relaxed doing therapy and using everyday interactions such as meal time, bath time, story time, and play to teach these skills. This training empowers our parents by providing them with the knowledge and tools they need to feel confident and effective in providing speech therapy in their homes. These are called parent training skills that we instill in our parents. The very first one is modeling. Parents learn to provide a clear, slow model of the target sound or word. As you can see in the picture below, there is a parent practicing with her child. So this is modeling. Whatever she is doing, the child is imitating her. Then you also have focus stimulation. Parents learn to use the target sound repeatedly in a fun, natural way to encourage imitation. Then we also teach them to give positive feedback. Parents give specific positive reinforcement for correct attempts. Positive reinforcement can be a thumbs up, a praise, a well done, a high five, privileges like extended screen time. All these are done to increase the likelihood of desired behavior being repeated. We want to make the home a therapy hub. Why do we want to make the home a therapy hub? Because the home provides a rich, natural environment for learning and practice. Speech therapy is integrated into daily routines like the playtime, meal time, and story time. This method aims to ensure that children use their skills outside of a structured therapy setting. So we are going to have a look at the home-based interventions for the years 0 to 8 months. Our focus here is on encouraging vocal play, babbling and imitation of sounds. Parents are taught to babble back, sometimes to sing back or say a story, rhymes to their babies to reinforce vocal communication. Our goal here is to build a solid foundation of oral motor skills and sounds before a child starts to talk. Then we have the toddler years, that's from age 18 months to 3 years. From age 18 months to 3 years is where there's rapid increase of words in these children. So our focus shifts to expanding vocabulary and the child's inventory of sounds. Parents learn to use games and songs to practice specific sounds and words. Early intervention at this particular stage is very crucial to prevent the development of hard-to-break compensatory errors or mislearning. And then for preschool and school age, that's from ages 3 years and above, therapy becomes more targeted, focusing on specific articulation errors. So here, if assessment has been done and the speech errors are detected, therapy becomes more targeted on the speech errors. And then the training is focused on that errors. Parents use visual aids like mirrors to help the child understand tongue and lip placement. Activities include practicing target sounds in syllables, in isolation, syllables, words, phrases, and sentences with increasing complexity. What is the role of technology in speech therapy? And this is where we come to TeleCleft. TeleCleft was developed by Smile Train Africa during COVID-19 pandemic era, because during that time, we're not able to see patients in our clinic. So this was developed to bridge that gap. And it has been of importance because not only did it help during that time, even now it has really helped most patients, those in the rural areas remotely. It's been of very help. And so we are saying that TeleCleft uses video conferencing to provide remote therapy sessions. It makes therapy accessible for families in rural areas as well as urban areas or those with transportation challenges. The speech and language therapist or pathologist can observe parent-child interaction in the home setting, providing more relevant and personalized structure. Then the role of technology. We have some apps and resources that we use. Examples are the Articulation Station Hub. We have the Speech Box. We also have the Speech Tutor, Speech Flipbook. All these are apps that aid in speech therapy in the homes. Mobile apps and online platforms provide a library of fun, interactive games, and activities. These resources are designed to make home practice engaging for children. They often include video tutorials and resources for parents to reinforce their training. So after they have been trained in the clinic, when they go back to their various homes, these apps also help them. It's not going to replace what the speech therapist has done, but it's going to reinforce what has been taught. So we have parent-implemented intervention, research evidence, what research has said about training parents to give speech therapy in their various homes. Numerous studies have shown that parent-implemented programs are effective in improving speech outcomes. Research indicates that children with involved parents make quicker progress and have longer-lasting results. So if you are doing therapy for a patient and the mom is outside, whatever you do with the patient remains in the room, because when they go back to their environment or their homes and the child is doing it wrongly, the parent will not be able to correct it because she was not part of the therapy. So research is saying that when we involve them, they make quicker progress and they have lasting results. Another study showed that parent training can be a viable and effective model, especially in areas with limited access to professional services. This is because if we have a limited number of professionals in a particular community or in a particular region, the mothers come in to help with this deficiency that we have by being trained properly to give speech therapy to their wards. How do we overcome challenges? We've acknowledged that there are challenges that these parents face, like parental stress, time constraints, and sometimes lack of cooperation on the side of the children. So we emphasize the importance of setting small, achievable goals to build momentum and confidence. We advise them that they shouldn't expect a magic overnight. They should start small. So if they are from 1, they should be expecting to move to 2, not to make a very big impact in just like a week or in a month, but starting small, achievable goals like 15 to 30 minutes every day. It will help them achieve their goals. And a speech and language therapist's role, or our role, is to be a supportive coach and a resource for parents when they face difficulties. Collaborative partnership. The parent, the child, and the speech and language therapist form a harmonious team with a shared goal. Our goal here is to make sure that all the mislearning, the compensatory articulation errors are being cleared or are being solved. So that is our goal. When we form a team, our goal will be achieved. Communication is very key here with regular check-ins and progress. So you call on them, you do video conferencing to find out how they are doing. And then you don't just go and take over the therapy session, but you are there to guide them. And our goal is to move from a therapist-led model to a family-centered one. So in conclusion, I'm saying that consistent home practice is the most important factor in a child's success. If you want to be successful in speech therapy, consistent home practice is the most important factor, in that it doesn't matter the number of hours that you spend in the clinic. If they go home and they do not practice what has been taught, you won't get success. Parents are capable and effective partners in therapy when properly trained and supported. So a combination of professional guidance, an empowered parent, and daily home practice is the gold standard for care. These are my references. Thank you. Auntie Amelia.
Thank you for your insightful presentation, Madam Barbara. Now we move into our question and answer section. Please, if you have not dropped your questions, then please do that now. Thank you. Please, are there any questions? Please drop the questions in the question and answer box. The child, that's the question. How do you get the child to articulate in their local language? Hello? Please, we are dropping the questions in the chat box.
Not the chat.
We are
Not the chat.
okay. Okay. Hello, Madam Barbara. Somebody is asking,
Yes, ma'am.
how do you get the child to articulate in their local language?
Okay, so thank you very much. What we do in our setting is that most of the time, our patients are either speaking, majority of our patients speak local dialects, where we have parents who does same, and some of them speak English. But mothers are trained, it doesn't matter your language, placement for plosives are the same in all languages. So when we take the P, B, M sounds, we need the articulators, the lower and upper lips to come together to form these sounds. So wherever you meet P, whether in your dialect or in English, you are being taught to bring your two lips together. Same with other speech sounds. The T, you need your tongue to touch the alveolar ridge. So because we have these patients coming in with their parents and most of us speak our language, we are able to deliver the best of therapy to them, and the mothers get it. So it's not really a challenge in here, but in situations that we have language as a barrier, we look for people or colleagues who can speak their language, and then we do the therapy with them in the presence of the parents as well as the child. I don't know if it answers the question. Thank you.
Okay. Yeah, somebody is asking me to share my experience as a teacher in encouraging parents. As a teacher, your question is not clear to me. As a speech therapy or a teacher. You know, one thing about speech errors, speech errors are that we have the speech sound, then we have the alphabet. In maybe trying to get the errors, you know, it's the same in the vernacular. I just want to add something to what Barbara just said. It's the same thing in the vernacular. The speech sounds is the same thing as in the vernacular, just as in English too. So what some of the parent struggles, somebody is also asking some of the struggles parents share in working with the journey. In their journey, some of them are the distant from the center. They are far away from the center. And some of them too, they are not able to cooperate with their children. Some of them, whatever we study or whatever activities we give them in the clinical room, they will not go over again. They will not go over with the children, but we expect them to practice with the children. And some of the children too, they said they are not cooperative. They don't cooperate with them because it's the parent who is teaching. So bringing out this teleclass, it will be a very good idea in that the speech therapist will be the supervisor. So when they hear the speech therapist in collaboration with their practice, I think the children will be able to do well. The children will be able to do well. So these are some of the challenges maybe the parents face. As I've said earlier, the distance from their homes to the clinic. And also the financial challenges. Not every parent can be able to come maybe monthly. They cannot afford that. So a lot of them have financial challenges. That's all I can say for now. Then another question to Auntie Barbara, how often do you review these children in your clinic after they have had their evaluation? Then the second one too is, if this technique has worked for you, how do you think other speech partners in Africa could replicate, how do you think other speech partners in Africa could replicate? Then also, what barrier do you think they might face and how to overcome them? Hello?
Auntie Emilia, please, can you give it one at a time so that I can answer them, because putting them together will make it difficult to answer them. So if I could get it one after the other, it would be very helpful.
The first one is, how often do you review these children in your clinic after they have had their initial evaluation? That's the first one.
So thank you. After the initial evaluation and then the therapy, we would want to see them monthly. Sometimes we want to see them every week. So we expect that when you come in the next 2 weeks, you should be able to come back for us to evaluate what you've been doing. And some would prefer to do it monthly, all because of the struggles they are facing. Like someone asked on, somebody just asked, logistical burdens and financial burdens. You might want to see them in a month or 2 weeks, but this parent is financially burdened. Logistically, even the time to come to the clinic is a factor. This person has other kids that she has to see. So her focus is not on just this particular child, but on other children. So all these things makes it very difficult to come. And then proximity-wise, okay, so it becomes difficult. But those who are very involved in therapy, those who really are helping their kids, comes around. Sometimes you have to call them and then you have to remind them. But for our end, majority of our patients come back to us for evaluation. What our challenge has been is that when you teach this particular parent how to do therapy, she goes back home and the child is being sent to the dad who has not been taught how to do therapy. Okay, so we go back to square one or we go back to zero because this dad has not been trained. He doesn't even know how to do placement for P. So they go back and they don't do any of the assignments and then they have to come back. So we do regular checkups on them and then we try our best. Thank you.
Yeah, the second question is, if this technique has worked for you, how do you think other speech partners in Africa could replicate? What barrier do you think might face and how do you overcome them? I hope you have got the question.
Okay. Yes, yes.
Can I repeat it?
So, no, I'm okay, thank you. So it's working for us. Initially, we were doing the traditional speech therapy model where we focus mainly on the child. We leave the mother on the side or the dad on the side or the guardian on the side, and we focus more on the child, forgetting that when they go back home, it's this parent who is going to help them with the assignments. So now we are engaging more of the parents in therapy because as they go back home, these are the same people who are going to take them through. So it's been very helpful. We've seen improvement and progress over the period that we've started doing this. There are times that these parents send us videos of what they've been doing with them. And when we see a deviation, we just send them a video back of the right thing to do so that they will not move off track. And then one of the barriers that we have with Telecleft is, it's an app that has to be on a smartphone. So parents who don't have access to internet and a smartphone becomes a challenge. So that is the barrier we are having. And then cooperation on the side of the children. Because it's their parents, they feel relaxed. They feel if I don't do it, it's my dad, it's my mom. So that is also a barrier that is delaying some of the progress of our children or our clients. Thank you.
So thank you, Auntie Barbara. The next question is, how do you manage those with hearing challenges? How do you manage those with hearing challenges?
Okay, so for speech therapy in our setting, our protocol is that any patient that comes to our center has to do a hearing assessment. And we have an ENT surgeon in our team who does that. So in cases where they see they have hearing problems, that problem is being rectified before speech therapy can commence, because if the patient is not hearing anything, it will be difficult for them to speak. Okay, so the ENT surgeon comes in to solve the issue before we go on with therapy. And another question was, what happened in case of parents who are dumb and deaf? This particular question is somehow, but I think it has to do with sign language. I have not learned sign language, and I don't know anybody on our team who knows how to do sign language. But in such situations, we want, I'm not too sure both parents will be dumb and deaf. So the other person or a guardian or a relative who also lives with the child is invited so that speech therapy, the person can be trained to help the child in speech therapy at home. Thank you.
Thank you, Auntie Barbara. The next question, the last question, might be the last question. Is there any concern that parents or guardians might start to rely too much on mobile apps and online platforms to train their children instead of in-person interaction for speech therapy?
The question again, please.
Yeah, the question is saying that is there a concern that parents or guardian might start to rely too much on mobile apps and online platforms to train their children instead of in-person interaction for speech therapy?
Yes, it's been a concern. Even before we start therapy, we have kids who comes in stuck to their phones, their tablets, their screens in their homes already. Okay, so it's a concern, but mothers are trained in such a way that they should not rely on it. Okay, if you're going to rely solely on that, it's not going to help. So we train them that even though we need them to, if you have an app that can help you in your training, it's good, but you don't rely fully on that because it's not going to be the best. And sometimes there will be deviations as they are on it. They can go to other sites and even stop doing the therapy. So we've even discussed with them that in as much as it's helpful, they should take caution when using the apps, but rather a face-to-face with the child, a one-on-one with the child for therapy is of essence because it's going to do a lot for the child.
Okay, somebody would also like to know if there is a psychological support for those parents given the mission that falls to them, since learning can take a time. Are you okay?
Yes, I'm okay. So we know the mothers, we have been trained, and now we have to train them to do what we are supposed to do. Okay, so we start small and we take them through. We had patients, parents that came in and told us that they've not been to school. How do they do this? But teaching placement doesn't need illiterate, okay? Because the placement are the articulators that are coming together. And these things are visual. So when you teach them how to do placement, putting your lips together, putting your teeth together, putting your tongue behind the alveolar ridge and stuff, this doesn't take a literate to do such things. And then in addition, you add syllables, and then as you progress, you put in your words and your phrases and sentences. And we try as much as possible to do them to their understanding. We are not trying to do them in our way. We bring it down to their level so that they catch it and they are able to give their best. So we've really thought about them. We keep on encouraging them that it's not easy. Even as when we were going through the training, we had challenges. So we understand them, but it's one step at a time, and they are doing well. Those who are very motivated and know the impact of speech therapy in their child's life are doing so much well. Thank you.
Thank you, Madam Barbara, for sharing your knowledge. Thank you, my audience, for your engaging questions. We have come to the end of the session. Good evening. Over to you, Madam Emily Manjero.
Thank you so much, Madam Emilia. Thank you, Barbara, for the encouraging and motivating presentation, and also really being patient enough to hear our questions. Indeed, it is almost like a whole community that comes together to support patients with clefts to be able to speak and articulate themselves, and how better to boost their confidence in their recovery journey than involving the parents. Thank you, Barbara. Thank you so much, Emilia, once again. This, I think, breaks the record of being the shortest telecleft lecture in the history of the sessions, but I would like to really express our heartfelt gratitude to all the participants, and we look forward to the pleasure of your company next month on the third Tuesday of October. As we come towards the end, allow me to quickly announce that World Smile Day is coming up on the first Friday of October. And I'm looking forward to seeing a lot of our partners, especially yourself, being able to share on your social platforms on what makes you smile. It can be your friends, it can be your family, it could be your work, and also seeing your patients smile could be something that makes you smile. So follow the hashtag and follow our social media platforms. That's Smile Train Africa, Smile Train Afrique on Facebook, Smile Train Afrique on on X, and Smile Train Africa Official on LinkedIn. Please share and put a hashtag, a smile wall, and let us see from you what makes you smile. Before we go, so sorry, I see that Rosalinda has quickly slid in. I don't know whether it was a question, but Rosalinda says, thank you for the presentation. I'm a nurse anesthetist from Federal University Teaching Hospital, Lafia, Nasarawa State in Nigeria. Thank you, ma'am, for being part of this amazing, amazing session. Rosalinda Maji, thank you for being here. We really appreciate all of you and your time, and we look forward to a lot more interaction in the next month, as well as World Smile Day on the first Friday of October, which is on the 3rd. Wishing you a fantastic rest of your evening. Goodbye and God bless.